Life expectancy is a key statistic that provides insight into the overall health and well-being of a population. It refers to the average number of years that a person is expected to live from birth, based on current mortality rates. Life expectancy can vary significantly between different regions and countries, and is influenced by a range of factors, such as access to healthcare, quality of living conditions, education levels, and lifestyle choices. For example, in countries with higher levels of poverty, lower access to healthcare, and higher rates of violence, life expectancy may be shorter compared to countries with greater economic development and better healthcare systems. Infant mortality rate is a critical indicator of a country's healthcare system and overall social and economic development. It refers to the number of infants who die before reaching their first birthday per 1,000 live births. Infant mortality rates can vary significantly across countries and regions, depending on various factors such as access to quality healthcare, nutrition, sanitation, and education. Exploring infant mortality rates can help policymakers and public health experts identify the underlying factors contributing to high or low rates and develop appropriate interventions to improve the health outcomes of mothers and infants. Maternal mortality rates refer to the number of women who die during pregnancy or within 42 days of childbirth per 100,000 live births. Maternal mortality is a critical public health issue, and reducing maternal mortality rates is a key development goal. Reducing maternal mortality rates requires a comprehensive approach that addresses the underlying social, economic, and health factors that contribute to maternal deaths. Efforts to reduce maternal mortality rates include improving access to quality healthcare, increasing access to family planning services, improving nutrition, and addressing the social and economic determinants of health. The leading causes of death around the world include a mix of non-communicable diseases such as heart disease, stroke, and cancer, as well as infectious diseases such as respiratory infections, HIV/AIDS, and diarrheal diseases. These diseases are responsible for a significant proportion of deaths globally and contribute to the global burden of disease. Non-communicable diseases are increasingly becoming a major public health concern, and efforts to prevent and control these diseases are essential. Prevention efforts include promoting healthy lifestyles such as regular physical activity, healthy eating, and avoiding tobacco and alcohol. Effective management and treatment of these diseases are also crucial to prevent complications and improve outcomes. Disease prevalence is an important aspect of public health that involves examining the frequency and distribution of diseases in populations. HIV/AIDS, malaria, tuberculosis, and COVID-19 are some of the most prevalent diseases globally. HIV/AIDS is a viral infection that attacks the immune system, while malaria is a mosquito-borne infectious disease that can lead to severe illness and death. Tuberculosis is a bacterial infection that primarily affects the lungs, and COVID-19 is a respiratory illness caused by the SARS-CoV-2 virus. Understanding disease prevalence helps public health officials to identify high-risk populations, allocate resources appropriately, and develop effective prevention and treatment strategies. Access to healthcare is a critical factor in promoting good health outcomes and reducing health disparities. However, not everyone has access to basic healthcare services due to various barriers such as financial, geographical, and social factors. In rural or remote areas, limited availability of healthcare facilities and providers can also impede access to care. Social determinants of health, such as race, ethnicity, and socioeconomic status, can also play a role in healthcare access. Addressing these barriers and improving access to care for all individuals is essential for achieving health equity and improving overall health outcomes. Mental health disorders affect millions of people around the world, and the prevalence of these conditions is increased. Depression, anxiety, bipolar disorder, and schizophrenia are some of the most common mental health disorders globally. Despite the growing recognition of mental health as a public health issue, stigma still surrounds these conditions in many places. People with mental health disorders may face discrimination, marginalization, and social exclusion, leading to barriers in accessing care and treatment. Environmental factors, such as pollution and climate change, have a significant impact on global health. Pollution, both indoor and outdoor, can contribute to respiratory illnesses, cardiovascular disease, and cancer. Climate change is also a major public health issue, as it can exacerbate existing health problems and create new ones. Rising temperatures, extreme weather events, and increased air pollution can increase the risk of heat stroke, asthma, and other respiratory illnesses. Climate change can also lead to food and water shortages, which can contribute to malnutrition and infectious diseases. Addressing these environmental factors through sustainable policies and practices is essential for improving global health outcomes and ensuring a healthy future for all. Immunizations, or vaccinations, are a crucial tool in disease prevention and have helped to eradicate or control many infectious diseases globally. Vaccines work by triggering an immune response that helps the body recognize and fight off specific diseases. The rates of immunization vary around the world, with some countries achieving high levels of coverage and others struggling to provide adequate access to vaccines. Immunization programs have been particularly effective in preventing diseases such as polio, measles, and rubella. However, there are still challenges in ensuring equitable access to vaccines and addressing vaccine hesitancy. Encouraging vaccination and promoting access to vaccines is essential for maintaining and improving public health. Healthcare spending is a critical factor in providing access to healthcare services and improving public health outcomes. However, the amount of money countries spend on healthcare varies significantly, with some countries spending more than others. High healthcare spending does not necessarily equate to better health outcomes, as factors such as efficiency and quality of care also play a role. Effective healthcare spending involves investing in preventive care, addressing health disparities, and promoting evidence-based practices. Additionally, ensuring access to affordable healthcare services for all individuals can improve overall health outcomes and reduce healthcare costs in the long run.